Hey guys, it's Doc Heps here with UroCoach. So have you been thinking about testosterone replacement and not sure if it's right for you? Well, there's a bunch of new studies that have come out providing some interesting insight. I think you'll like this video. I think you'll learn a thing or two. Check it out. Hey guys, Doc Heps here with UroCoach. Make sure you subscribe, like, comment, and stay tuned to the end. I'll give you my tips and how I approach testosterone treatment. So maybe you've been thinking about testosterone replacement therapy and possibly looked into it, got a little freaked out by the potential side effects. So in this video, I'm going to synthesize the main questions about the TRAVERSE trial. It was a large randomized trial encompassing over 5,000 men. The main question or primary outcome was whether testosterone replacement in men with high risk of cardiovascular disease increases their risk of developing a heart attack, a stroke, or some sort of cardiac intervention like requiring a stent or cardiac surgery. Other secondary insights that the study provided were, does testosterone therapy increase your risk of developing prostate cancer? Does it affect anemia or your blood counts? Does it affect your mood, depression? Does it affect your sexual function? And there are a few other parameters that were interesting insights that were considered secondary outcomes. Let's get into the meat of it. Let me give you a little bit of a history of testosterone therapy. So in 2001, AbbVie and a couple of companies started making testosterone gel. They had a marketing plan. Testosterone had actually been shown at that time in non-randomized retrospective studies to potentially help improve cardiovascular profile. There were studies showing that men with lower baseline testosterone levels actually had a higher risk of cardiac events such as heart attack and death, indicating that there was an inverse relationship between testosterone and cardiovascular disease. If your testosterone was higher at baseline, without replacement, that is, you had less of a risk of cardiovascular disease, whereas if your testosterone at baseline is lower, your risk of developing heart attack, stroke, or some sort of cardiovascular issue was elevated. So what happened was men started getting prescribed testosterone therapy, and it improved their symptoms, libido, sex drive, other parameters. But in 2013, 2014, there were a couple of studies that came out that suggested that testosterone replacement may actually subtly increase the risk of heart attack or cardiovascular event. And all of a sudden, the FDA, along with other medical societies, came in and said there may be a weak association with cardiovascular event and testosterone. So with that, a black box warning on testosterone therapy was provided and prescriptions shot down. The FDA empowered the pharmaceutical companies to come up with a formal study to investigate whether testosterone was associated with increased in heart attacks and cardiovascular events. So it took about 10 years, and finally we have the results of this trial. This trial is called the TRAVERSE trial, and the main outcome and main question they wanted to ask was, does testosterone increase a man's risk of developing a heart attack, stroke, if it is replaced? So they looked at about 5,000 men who had low testosterone, less than 300. They split them in half, and they gave half of these men testosterone gel and the other half a placebo gel. And these men had either underlying cardiac disease or they had an elevated risk of cardiac disease, to include diabetes, hypertension, a family history, and obesity. These men are at high risk of developing some sort of cardiac issue. Over the next 2 to 3 years, they monitored them, and they found that testosterone replacement in this group of high-risk men did not cause any increased risk in heart attack, stroke, or need for cardiovascular intervention, such as a cardiac stent or coronary artery bypass grafting. This study really puts to rest, I believe, the question as to whether testosterone replacement potentially causes cardiovascular problems in this high-risk group of men. Obviously, this is reassuring information that we can safely prescribe testosterone replacement as appropriate in men with an underlying history of cardiac disease. What are other secondary parameters that were looked at? Well, these included prostate cancer. There was no increased risk in significant prostate cancer in men who were treated with testosterone replacement. These are men who never had a history of prostate cancer. Again, half of them were placed on testosterone therapy, the other half placebo, and there was no increased risk in these gentlemen of developing new onset significant prostate cancer. This is very reassuring as well. Another parameter was looking at just benign enlargement of the prostate. And testosterone replacement did not increase the risk of developing urinary symptoms or requiring some sort of surgery for just benign enlargement. Number 3, did it improve overall mood, depression? And yes, testosterone therapy actually improved overall mood, less risk of developing depression, less rates of mood issues. So testosterone replacement can potentially help with that issue. Bone health. The thought was testosterone modulates bone health potentially. There was no significant difference in the outcomes in terms of bone health between the placebo group and the testosterone group. Sexual function, a big one most guys are asking. So testosterone does improve overall sexual function in terms of libido, but erectile function, it made no significant difference. Now, these men were not treated with Viagra or Cialis, so we don't know if adding that would have had a synergistic effect, just something to think about. But overall, it did improve the mood, the libido, the sex drive, but no significant changes in actual erectile dysfunction. Last thing, diabetes. There was some suggestion in previous studies that diabetics had improved glucose control if their testosterone was optimized. This study didn't indicate any significant change, benefit, or negative effect on glucose control in the testosterone supplemented group. Bottom line is testosterone therapy in a high-risk group of men does not increase the potential development of heart attack, stroke, or requiring some sort of intervention for cardiac disease. Very reassuring for men who are interested in testosterone therapy, are having some of the mood symptoms, the depressive symptoms, the sexual symptoms, anemia symptoms, and just want to feel better. This reassures us in a definitive way that testosterone replacement does not really cause significant harm. No study is absolutely perfect, but this is the closest we're going to get with a randomized controlled trial in a high-risk group. Now, how do I approach my patients for testosterone replacement? Well, first we'll get testosterone levels, we'll ask them their symptoms, and if appropriate, I'll go over the potential risks and benefits with them. And usually I'll start these men on testosterone injections. We'll talk about going to a gel or pellets, but typically I find that the most effective way to achieve normal testosterone levels, at least at the start, is to use an injection. Usually I'll use a subcutaneous injection either once or twice a week with a small amount to try and replicate as much as feasibly possible the physiologic diurnal rhythm. I found that the subcutaneous injection patients tolerate very well, and they'll effectively get therapeutic testosterone levels after the first or second injection. And within 2 to 4 injections, men will know if they're having significant benefit. If he feels great, then we just kind of cruise along and monitor blood work every 3 to 6 months, depending on how he's feeling. If he's not happy, we'll adjust the dose if necessary and adjust the way we can administer. If injections are not appropriate, we can talk about gels or pellets or other options. I appreciate you watching. Make sure you subscribe, like, comment. We'd love to hear from you. Check out the rest of our videos here at UroCoach. Thanks again.